We are going to start tonight with some COVID-19 updates because the virus is hitting the state harder than ever before. There are 7,497 new cases in the state. That is a new one-day record for cases in Wisconsin. It's also the fourth time since just this past Saturday that cases in the state have topped 7,000 in a single day.
There are 58 new deaths as more than 2,500 people in the state have now died from the virus. A little more than 1,000 of those deaths have happened in the past month. State health officials say only about 8% of ICU beds are available in the state, and there's concern that more and more hospitals will have to start diverting patients because they're just unable to care for them.
COVID-19 is everywhere in our state. It is bad everywhere, and it's getting worse everywhere. It is straining hospitals, and people are dying.
14 people are currently being cared for at the alternate care facility at State Fair Park in West Dallas, where overwhelmed hospitals are currently sending patients they don't have room for at a hospital. Earlier this week, Governor Evers announced an executive order advising Wisconsinites to stay home as much as possible.
In La-Crosse County, there are 185 new positive COVID-19 cases in the county, according to the state's Department of Health Services. Now more than 6,000 people have tested positive for the virus. The county is averaging 135 cases a day over the past week. That is the highest average during the pandemic, breaking yesterday's record. The average was 32 a month ago. 33.7% of tests in the county over the past week have been positive. A look at more COVID-19 numbers from around our region in just a few minutes.
When hospitals are threatened and care is at risk of being delivered in a normal way, everyone loses.
As cases and deaths continue to rise in our area, local health leaders are asking for the community's help to slow the spread of COVID-19. Earlier this week, Mayo Clinic Health System announced its locations in northwestern Wisconsin are at capacity. Doctors say the trend in cases here and across Wisconsin is alarming.
If things don't change in terms of each one of our individual behaviors in trying to prevent the spread of disease, there are projections that this region and our hospitals could be reaching capacity within the coming weeks.
Dr. Kowalski says the ability to care for community members is also impacted by healthcare workers that are unable to work because of testing positive for COVID-19 or having to be quarantined because of exposure.